So my name is Matthew Pears, and I will present the co-creation method for the University of Nottingham's resource, along with demonstration of usage. Okay, so CoViRR aims to co-create virtual reality reusable e-resources, and at the end goal is to enable students to increase their clinical skills by offering both immersive and flexible learning. The partners are University of Nottingham, Aristotle University of Thessaloniki, and the Research Centre on Interactive Media, Smart Systems and Emerging Technologies, which recently has been changed to Science in Cyprus. And video recordings are a dependable tool used by CoViRR. They can easily and quickly capture lots of rich content and context. They are easy to create, and you can have several hours worth of videos and can be processed quickly. And multiple cameras can capture multiple shots of the same event. And generally, the flexibility in video recording makes it very useful. And an example of video usage in education, at the University of Nottingham, we have Engage. It's a video platform designed to foster video-based learning. Staff can record lecture audio and visuals either in a teaching room or their office or from home, and they can live stream lectures. They can add interactivity as well for use in recordings or their live streams. So students are able to access recordings of teaching sessions to enable them to review content at any time. But obviously we're asking, how about 360 VR videos? So there can be limitations in time, expense and realism in virtual environments that create content with 3D models. But the benefits for 360-degree environments are all what we have with 2D videos, but with the addition of providing VR users with a sense of realism and fidelity that is more natural. Obviously, we are recording natural events. And if you would like to try 360 videos, of course, we have resources available, but also YouTube has improved their VR video support, and there is a lot of content, either educational or for fun. So if you use a headset in the future, then YouTube is a good place to start for educational videos. There's a few links I've got here. I can share them afterwards as well. And VR can allow the users to do things that is more immersive with more detail, as it's obviously 360 degree, and it's therefore more engaging. The user has full content of what they decide to view when they view it, and most applications are simply install and run, which helps them to have positive experience in setup and usage. So coming to the RLO, effective communication to adolescents through their eyes. In developing the RLO, understanding the experts is vital. And in fact, it's all participants. So end users are the experts on how they will use the RLO and how it should feel and look. Healthcare professionals are experts on the content that is included. So it is through this community development that we start to design a resource. And a framework developed by the University of Nottingham called the Aspire framework was used and has had success in many years in its ability to facilitate RLO creation. It's named the same as a piece of architecture on the campus itself, which I don't know the full name. I think it's the Aspire Tower. It could be the Aspire, just the Aspire, but nonetheless, it's named the same. And it stands for Aims, Storyboarding, Population, Implementation, Release and Evaluation. And at the end of these processes, stakeholders involved will have worked together to create a resource that combines the needs of the end users in the aims and storyboard steps. Then the expertise from healthcare professionals that appears kind of in the storyboarding and population steps. The design then from learning technologists appears in the population and implementation steps. And facilitated by the research-driven approach in academia, which is kind of the release and evaluation steps. And these can differ, but that's kind of a rough guideline. And again, it has been a proven framework to allow stakeholders to kind of envisage potential e-resources. And the aim of our current RLO was to provide registered children's nurses and student nurses and other health professionals with communication skills and strategies in situations that require additional levels of skill with children and young people. And there are RLOs available that maybe assess risk, surround communication with self-harm hospital admissions, and allow users allow understanding of care pathways. But for time, I will not review this one of the current RLOs, but I will add the link in the chat at the end of the showcase. This RLO was the product of the Aspire framework, but it was not in VR, so we needed to repurpose it. And again, we started the Aspire process again. There's an advantage of this framework. It's cyclic in nature, and you can use it to adapt to your goal. And this online tool is called Mural, and it allows multiple people to create a storyboard with a flow that they desire, with images and videos to help capture their ideas. And to facilitate this repurposing, the storyboard session is then converted into a specification using an online specification system with the health e-learning and media portal. And this is really important, as it provides opportunity for review by sharing this with the end user and the healthcare professionals and learning technologists as the method to really confirm by the team of the final learning object. And it's with these steps in the Aspire model, if they're followed, then a user-defined resource with healthcare professional approval of content and optimized design for effective usage will be created. So based on all of this, we would like to show you the RLO created that allows you to be both a community support worker going to visit a young adult in their home, but also then it switches to allow you to be that person, which is receiving support from the healthcare visitor. And in this RLO, you will be able to experience examples of communication that demonstrate strong skills in interaction with the young adult, and also communication skills that are less optimal. And you are able to experience the feedback from the young individual themselves to really reflect upon the effects of communication in this context. So unfortunately, with any development, there are issues. And although we have successfully distributed this RLO previously, the Google Play Store, where the RLO is located, has done something that prevents us from opening the application. We found this out yesterday. So although it's disappointing, this is kind of very common when creating new technologies. We kind of have to adapt. So I've created a video for the RLO that was running on a Windows computer. This allows you to get a good overview of the RLO. And if you're interested, obviously, as soon as the mobile application is available, I'm sure we can make a link to the website or some documentation. So this was the RLO, so we can add this to the chat, and by all means you can try to make the mobile application work, but it's currently out of use, unfortunately. So with that note, if we're okay, I'll continue with showing the video. And apologies again, it was late last night when I did this. Okay, well, I can give a commentary. So James now is the community support nurse, and the young adult is giving is kind of saying quite an alarming statement. So the the content has kind of embedded clinical support or psychological theory and methods and practice embedded in the chat, and it's kind of an overlay of communication. What's presented as a good example of how you can wrap this content into very useful and positive communication, if you like. I'll just try the sound one more time. So this video is now ended. We've obviously gone through the good communication. So he's asking, is there any way we can, in the short term right now, help you in this situation? Right, yes. So that thank you. That's 11 o'clock. So that's 15 minutes. That's, I think we're back to a little bit more of a schedule. And I'll hand this over to the next presenter.